Nathan, thank you. In just over an hour, Governor Asa Hutchinson will hold his weekly COVID-19 briefing. That is at 1:30 this afternoon. And it comes as we see the smallest one-day increase of COVID cases in nearly 2 months. Take a look at these numbers. We added 583 new cases in Tuesday's report. We haven't seen an increase that low since July 19th. Active cases are down nearly 2,000 at last check, sitting at nearly 19,800. And while these numbers are encouraging, that's usually the case coming off of a holiday weekend like we are right now. 8 more Arkansans are in hospitals fighting COVID-19 this afternoon. That makes 1,228 in all. 321 of those patients are on ventilators. That's up 1 from Monday. And the virus has claimed the lives of 38 more people in the state. Again, the governor will address the state at 1:30 this afternoon. You can watch live on thv-at-noon.com. The city of Little Rock wants to get more people to take the COVID-19 vaccine. It announced a new program Tuesday geared toward just that. At certain clinics, if you get the vaccine, you can receive up to $100 per dose for each shot. Organizers say this could help bring up Little Rock's vaccination rate. Right now, 46% of the city is vaccinated.
You've seen states like Ohio, where they were giving away $1 million a week. In 1 week, they saw a 56% jump in demand. And then the second week, it just dropped back to where it was.
Little Rock's first sponsored clinic for this new incentive program is this Saturday at the Southwest Community Center. You can find more information right now on thv-at-noon.com. After the Labor Day holiday, officials are bracing for a spike pardon me right there. After the Labor Day holiday, some states are bracing for a spike in coronavirus cases. We're going to get to that story here in just a moment. But first, we want to talk about evictions here in Arkansas. Stories on evictions, they are like stories on COVID-19. You can look at charts and numbers, but what about the people behind them? After the nationwide eviction moratorium expired last week, thousands of renters were stuck searching for financial aid. THV 11's Sarah Herbakowitz explains why it's taking so long in the state and in Pulaski County.
Danette Perry is packing up her entire home. Once protected under the eviction moratorium, Danette came home from work to an eviction notice.
My landlord ran to the courthouse to apply for the eviction notice.
And severely financially impacted by the pandemic and with limited work hours due to her rheumatoid arthritis, Danette has been searching for help.
I immediately started applying for everything.
All to no avail.
Because I knew, with it just being me and my hands, that I wasn't going to be able to do it by myself.
And she's not alone. Of the $173 million allocated to the state from taxpayer dollars, less than 5% has actually been given out to help renters. But under a separate program, Pulaski County has given out more than 40% of its available funding, as thousands more applications still await approval.
We are in the midst of processing, I would say, hundreds of applications.
That sheer number of applications is one of the reasons for the delay. County officials say it could take 30 to 45 days for help to arrive.
As of today, Pulaski County has probably received almost 10,000.
Another big delay comes from the need for cooperation from the landlord.
If a landlord does not want to participate, that can stop an application. Okay. Because you really need that information to certify the debt that the tenant has.
Leaving assistance programs with limited staffing to work new paths.
People could just give us a little time. We can actually get the assistance out, and that's both landlord and tenant.
So that people like Danette can turn to get help.
I don't know what tomorrow looks like. I mean,
as the system works to speed up relief. Reporting in Little Rock, Sarah Herbakowitz, THV 11 News.
Both Pulaski County and the state say that they are working to streamline the application process going forward to try and avoid these delays. Having already been served an eviction notice, Danette's case has now been referred to the Emergency Solutions Program in an effort to find more immediate relief. For more information on all of this, text the word RENT to 501-376-1111. We'll send you information, or we'll send you links to resources. You can also visit this story on thv-at-noon.com. There have been plenty of claims spreading about the use of monoclonal antibodies, who can get them, and when you can get them. Marlisa Goldsmith sets out to verify.
A THV11 Verify viewer wanted to know, is it true that only patients in the hospital with COVID-19 can receive the monoclonal COVID-19 infusion? Or can you get it if you test positive with symptoms but not admitted to the hospital? To answer these questions, we turned to our sources, the Arkansas Department of Health, the Food and Drug Administration, and Dr. Patrizia Cavazzoni. They said monoclonal antibodies are not used for treating severe COVID. Instead, they should be given as soon as possible after you test positive to prevent complications. The FDA has granted emergency authorization for several antibody treatments used for the treatment of mild to moderate COVID-19 in adults and pediatric patients who are at high risk for progression to severe COVID-19. The Arkansas Department of Health explains these antibodies are laboratory-made proteins that mimic your immune system's natural virus-fighting abilities. On their website, they say non-hospitalized patients with mild to moderate symptoms can get the treatment up to 10 days after symptom onset if they have any of the high-risk factors shown here on your screen. The FDA has also authorized this treatment in high-risk people who have been exposed to the virus, even if they haven't tested positive yet. Now, these antibodies are not approved for use in patients whose COVID case has already gotten bad enough to need hospitalization or oxygen treatment. Dr. Cavazzoni, director of the FDA's Center for Drug Evaluation and Research, says with the authorization of this monoclonal antibody treatment, we are providing another option to help keep high-risk patients with COVID-19 out of the hospital. So we can verify this claim is false. Hospitalized patients should not receive the monoclonal antibody treatment. Instead, it should be used before a case gets that serious. If you have something you want verified, let us help. Email us, verify@thv11.com.